Hello everyone. In this class, we'll try to briefly learn about diuresis. Diuresis is the condition where urine output is increased. Water diuresis. Increased water intake leads to decreased plasma osmolarity. This results in decreased secretion of antidiuretic hormone, that is ADH, which results in decreased water reabsorption in collecting duct. So the dilute urine is excreted, which is referred as to water diuresis. Effect of secretion of dilute urine starts 15 minutes after the ingestion of water uh, and reaches maximum at around 40 minutes. Water intoxication. Maximum urine flow in water diuresis is around 16 ml per minute. If the water is ingested at the rate of higher than this for any length of time, swelling of the cells because of the water uptake of water from the hypotonic ACF becomes severe. Swelling of the cells in the brain causes convulsions and coma and leads eventually to death. Water intoxication can also occur when water intake is not reduced after administration of exogenous vasopressin or secretion of endogenous vasopressin in response to non-osmotic stimuli such as surgical trauma. Osmotic diuresis. Presence of large quantities of unabsorbed solutes in the tubules can cause increased urine output, which is referred as osmotic diuresis. Medullary hypertonicity is decreased when ascending loop of Henle cannot reabsorb sodium maximally. It causes decreased water reabsorption from descending loop of Henle, which causes more fluid entry into collecting duct. So there is marked increase in the urine volume and increased sodium and solute excretion. Osmotic diuresis can be induced by administration of mannitol and infusion of large amount of sodium chloride and urea. Differences between osmotic diuresis and water diuresis. In water diuresis, the amount of water reabsorbed in the proximal portion of the nephron is normal, and the maximal urine flow that can be produced is about 16 ml per minute. In osmotic diuresis, increased urine flow is due to the decreased water reabsorption in proximal tubules and loops, and very large urine flow can be produced. As the load of excreted solute is increased, the concentration of urine approaches that of plasma in spite of maximal vasopressin secretion because of large fraction of excreted urine is isotonic with proximal tubular fluid. Diuretics. Diuretics are substances which enhance output of urine. These substances increase the excretion of water, sodium chloride through urine. Most diuretics used clinically decrease rate of sodium reabsorption in renal tubules. Natriuresis occurs then in turn increases the water output. The tubular reabsorption of many other solids like potassium, chloride, magnesium, calcium are influenced by sodium absorption secondarily. So many diuretics increases the renal output of these solutes also. Osmotic diuretics increases the osmotic pressure of tubular fluid, thereby decreases water reabsorption and increases urine output. Some of the sites of actions of various diuretics are like the drugs furosemide and other loop diuretics. They act on the thick ascending loop of the Henle, whereas thiazides they act on the early portion of the distal convoluted tubule, whereas drugs like aldosterone antagonists, spironolactone and trimetrin, they act on the collecting duct, and antagonists of V2, that is vasopressin receptors, they act on the collecting duct. And their mode of action is like furosemide, it inhibits mainly the sodium potassium 2 chloride transport. Thiazides they inhibit sodium chloride transport, whereas aldosterone antagonists inhibit the action of aldosterone on tubular receptors, and antagonists to V2 receptor uh, they inhibit the action of vasopressin. Xanthines like theophylline caffeine decreases the tubular reabsorption of sodium and increase GFR, and drugs like acetolamine, which are carbonic anhydrase inhibitors, they decreases H plus ions with the resultant increase in sodium and potassium excretion. And water and ethanol, they inhibit vasopressin secretion, and glucose and mannitol, they produces osmotic diuresis. Okay. So these are the actions of different drugs. Like furosemide acts on the thick ascending loop, where it is going to inhibit the reabsorption of sodium chloride and potassium, and thus they causes diuresis, whereas thiazides, they inhibit the reabsorption of the sodium and they causes diuresis, whereas the aldosterone, they act on the at this level to decrease sodium reabsorption, and the vasopressin antagonists, they act mainly on the collecting ducts, vasopressin receptors. This is in brief about the diuretics. Thank you.